Hi, my name is Emilia Subev. I'm a registered dietitian, nutritionist with the Academy of Nutrition and Dietetics. I specialize in weight loss and gastrointestinal conditions. Today, I'm gonna talk to you and help you figure out the reasons for your GERD, Gastroesophageal Reflux Disease, why it happens, what it is, and how can you help it. There are four major reasons why gastroesophageal reflux disease might happen. The first one is decrease in the esophageal pressure tone. The second one is increase in the intra-abdominal pressure. The third one is changes in the hydrochloric acid production. And the fourth reason is hiatal hernia. All right, in this video, I'm going to talk more in further detail about the reasons for decrease in gastroesophageal sphincter tone. You may already know what gastroesophageal sphincter is, but it really is a bundle of muscles that divide your esophagus from your stomach. Just like every muscle in your body, it is either tight or loose. When it becomes loose, it allows food matter and most importantly, hydrochloric acid to enter an area where it does not belong. So the hydrochloric acid is burning literally these tissues, causing pain, discomfort, and it decreases your quality of life. So why there might be a decrease in the gastroesophageal sphincter tone? The first very common reason is excessive caffeine intake. So if you cut back on your coffee and you have mild GERD symptoms, you might have significant improvement in your gastroesophageal reflux. The second reason is smoking. Quit smoking, and I know it's easier said than done, but smoking does loosen this muscle and allows hydrochloric acid to go up the esophagus. And the fourth reason, unfortunately, is stress. These muscles, just like every other muscle in the body, is innervated with nerves coming from your brain. And as you already maybe know, there is two branches of the central nervous system. On one hand, we have the sympathetic nervous system, which is our fight and flight response, and then the parasympathetic nervous system, where we are relaxed, and it is what we call relax and digest. So when you're very stressed and the sympathetic nervous system is ignited, you might have more GERD. You might have more symptoms, and controlling stress is very important for that. Now, there are some breathing exercises called diaphragmatic breathing exercises that might actually help with tightening this muscle over time. However, keep in mind that doing these exercises might take weeks or months for you to see results, because this is not like taking a PPI or H2 blocker. It's not a medication. It takes time, but I think it's a very effective way of controlling the tightness of this esophageal sphincter. I do have patients in my practice that we have used this technique for managing their symptoms with enormous results, and they did get off their medications after several months of doing the diaphragmatic breathing exercises. This is a paper published in 2021 from Amadi and colleagues that examines the effect of aerobic exercise and diaphragmatic breathing on the quality of life for people with gastroesophageal reflux disease. The paper concludes that diaphragmatic breathing significantly improved the quality of life with people with GERD by improving symptoms. However, the aerobic exercise did not achieve the same results. Now I'm going to walk you through the diaphragmatic breathing exercises to show you exactly what to do and how to practice this diaphragmatic breathing. The recommended time for practicing is at least a minute once a day. Lay down on your back with your legs elevated on a chair or a bed. Your hips should be 90 degrees angle, as should your knees. Ensure your head is elevated and supported so you can comfortably relax in this position. place your hands on your abdomen on either side of your belly button. The focus of this exercise is your breathing and diaphragmatic movement. Breathe in. Imagine the air filling down the bases of your lungs and around to the back of your rib cage. As you steadily inhale, you should feel your belly rising into your hands. Breathe out. Imagine the air being pushed down the base of your back in your lungs as it moves further up and finally out of your mouth. As you exhale, you should feel your belly relax down again. Continue this movement, focusing on your belly rising up as you inhale and relaxing back down as you exhale. Do not allow the bottom of your ribs or your back to push towards as you inhale. Just to summarize, there are 4 different reasons why a person can develop GERD. One of them, covered in this video, is a decrease in the lower esophageal sphincter tone. The reasons for the decrease in the lower esophageal sphincter tone are smoking, excessive alcohol consumption, stress, and non-steroidal anti-inflammatory drugs. Here are some solutions of how to manage the decrease in the lower esophageal sphincter tone. Breathing exercises, stress supporting supplements that will help you manage stress and ignite the parasympathetic nervous system versus the sympathetic nervous system. Supplements that I use in my practice that have shown promising results with managing GERD and stress are going to be included in the description below. Of course, decrease your coffee consumption and of course smoking cessation are the ways you control the decrease in this esophageal sphincter tone. Thank you very much for watching this video. Follow along for more videos on GERD and on how to manage GI diseases and lose weight.